This episode is brought to you by MeUndies. Underwear drawers are like the Wild West. You never know what you're going to pull out or what shape it's in. So upgrade your collection with the buttery soft comfort of MeUndies. MeUndies' signature fabric is as soft as a warm hug from your favorite sweater. Plus, it's breathable and oh so comfy, making it ideal for all-day wear. Get 20% off your first order, plus free shipping at MeUndies.com/Spotify with code Spotify. That's MeUndies.com/Spotify, code Spotify.
Today on CityCast Denver. In the last couple of years, it seems like you can get magic mushrooms like everywhere in Denver. But what are the actual laws around them? And who could benefit from the psychedelic-assisted therapy the state is rolling out this year? I sat down with a reporter from the Denver Post who covers all things psychedelic to understand what's legal, what's not, and what's next. Today is Thursday, February 13th. I'm Bree Davies, and here's what Denver's talking about. Teeny Ricciardi, welcome to CityCast Denver.
Thank you so much for having me.
So is it about to get a whole lot easier for Denverites to get their hands on psychedelics or what?
I would say it's pretty easy already, but within the context of the therapeutic model, yes.
Well, and that's what we're talking about because psychedelic therapy is rolling out this spring with some businesses already applying for the licensure. But before we get into that, Teeny, can you tell us how we got here in the first place?
Sure. So the story of legal psychedelics really starts in Colorado in 2019, when Denver became the first city to effectively decriminalize possession and the use of psilocybin mushrooms. That was when Denver sort of became a leader in this space. A lot of people began talking about that. Nationwide, too, it spurred sort of a movement to decriminalize. But as far as legal psychedelics and therapeutic psychedelic models, that dates back to 2022. There was a ballot initiative in November of that year that voters passed, which legalized psychedelic-assisted therapy, but it also separately decriminalized 5 different psychedelics: psilocybin, psilocin, DMT, ibogaine, and mescaline. So these 2 things are both now active and happening, but they're very different. They're separate, but they're parallel.
So let's move on to the psychedelic-assisted therapy, which is the thing that's rolling out, coming soon. Who is this therapy for?
Oh, that's such a great question. And it's one that I've been trying to pinpoint down too. So in the context of my reporting, I've really tried to figure out who is this for, because there have been studies done that show psilocybin, when used in a therapeutic way, can have pretty significant benefits, right? These are small studies and they're ongoing, but a lot of the conditions you hear about are things like severe depression, treatment-resistant depression, trauma, end-of-life anxiety. In a clinical setting, those conditions have been studied and shown that psilocybin therapy can be beneficial for some people. But when I talk to people and say, who is this for? Like, if people are considering, should I do this? I feel depressed. It's kind of squishy, right? So that's why part of the therapeutic model involves a medicinal intake, a survey, a questionnaire, talking with a professional at one of these places to see, are you a good candidate? Clinical trials typically exclude people with a family history of bipolar disorder or schizophrenia because psychosis is a risk and a potential harm. But I just talked to a woman who's opening a healing center the other day and asked her this question, and she just said, for people who feel like they've tried everything to regain their sense of self and something is still just missing. There's a piece that is just not fitting properly, and people who want to dive in, find out what's going on, and try to find that missing piece.
So you mentioned this woman that's going to be doing this. Who is that? Who is the person that would be providing therapy? Like, what kind of practitioner are we talking about?
So again, a lot of this comes from the underground, right? So this woman in particular is someone who has been working like this underground, but she is applying for licensure. She has a background in the healthcare system and dentistry, but a lot of social workers, psychiatrists are probably going to be involved in this. Legacy healers, there's a pathway for them to get involved as well. But basically, if you are going to be offering facilitation, so people who supervised trips are called facilitators. And if they're getting a license to do that, they need to complete specific approved training programs. And so they're going through, months worth of courses, ethical training, talking about the process from preparation, administration, integration, that kind of thing. So there is sort of a structured system that anyone who has a facilitator license will have gone through.
So someone that can probably handle a situation where someone has an adverse reaction to the psilocybin or the trip or what. I'm thinking about, like, in the recreational sense, it's like a trip sitter.
Yes.
Like someone that hangs out with you to make sure if you have a bad trip that you are safe.
Yes, absolutely. And there are a lot of clinical professionals getting into this. Like in Oregon, one of the women that I talked to was a licensed social worker. So she was doing a lot of this already and just wanted another tool to be able to offer her, patients that weren't finding success with other modalities.
So would someone be prescribed this therapy, or how would someone interact with the system once it rolls out?
Interesting question. I don't know about how the relationship between Western medicinal offices and psychedelic therapy will work. I think there's a lot of education to be done to connect those two things, just like in the professional space. But as far as I know, a lot of people are seeking this out on their own. So maybe there are some doctors in the know who say you could be a candidate for this. But I think the majority of cases are more like people saying, I'm really struggling. Nothing has worked for me. I don't want to be on prescription meds, so I'm going to try something new and novel.
Yeah, and I have to say I've heard that from friends who have maybe utilized this pre-decriminalization as an option for depression in particular. Like, I have some friends that microdose daily.
Sure.
And that has seemed to work for them much better than, they've been on SSRIs, they've done tons of therapy, and this seems to be the thing that works. So this would kind of just be another option. But at this point, it doesn't sound like your psychiatrist may necessarily prescribe it, but it could be something that you could walk into an office yourself and decide you want to do.
Yeah. And, there are psychiatrists in the know who are embracing this and curious about it. So there is the potential for that. Now, I don't know. It's still kind of murky about whether a psychiatrist who's licensed could get in trouble for doing that.
Sure.
But you mentioned microdosing, which is interesting because microdosing is sort of a weird piece of this.
Okay.
Typically, the therapeutic model, we're talking about large doses, like multi-gram doses. So you go in and you commit to, ingesting 1 or more grams. You have an eye mask, you have headphones, and you really dive in deep. That's the traditional sense. However, I have talked to a couple that are opening a healing center, and they're looking to make it more approachable because microdosing is very popular right now. And the therapeutic model isn't built for that necessarily. Like there are regulations that say, at least 6 hours before someone can leave your healing center. Well, if you're just doing a microdose, you don't need to be there for 6 hours potentially. So there are new rules that are written around microdosing. And this couple who wants to open a healing center really wants to focus on that and create less of a lay down, drop in situation and more of a activate the space where you can indulge your creativity or do things, under the influence of a microdose while also having a facilitator or sober sitter there.
Interesting. So these psychedelic assisted therapy centers will be rolling out to provide this as sort of like a treatment. Like you go in for several hours.
Yes.
And it's a much bigger dose than I think it sounds like than maybe folks even are used to who have used it recreationally. Because a gram sounds like a lot to me.
Totally. If you've used it recreationally, you know that multiple grams is quite an experience. And so it is quite a commitment too. And there's no guarantee what is going to come up for you.
Sure.
And a lot of the people that I've spoken with who have done this in the underground or done it previously or done it in Canada say that it is transformative. It's not always easy.
So where will this therapy happen? Do we know what a psychedelic assisted therapy center might look like or where it would exist?
Yeah, where it will exist will be dependent on which local municipalities are really open to this. I visited a healing center. They don't call them there in Oregon. They call them psilocybin service centers. And I visited one there, and it is probably a lot more nondescript than you would think. It was a one-story building. You walk in, there's a front desk. There are 4 individual rooms, and there's no psychedelic memorabilia. There were pillows. There were chairs. It just seemed like kind of a house. So that's a model that's pretty popular. But from what I'm hearing from the first folks getting licensed in this space, that is that there are potentially more models that might be popping up, and TBD on what those exactly look like.
This episode is brought to you by Denver Health. Did you know that Denver Health is home to one of the most comprehensive pediatric care systems in Denver? From bumps, bruises, and fevers to more serious conditions, Denver Health's pediatric urgent care is there for families when their little ones need immediate attention. But sometimes a child's care requires more than an urgent visit. That's where Denver Health's inpatient pediatric unit comes in. As part of a level 1 trauma hospital, this specialized unit is equipped to handle complex conditions, ensuring children receive expert, quality care from board-certified pediatricians that you can trust. With providers trained to treat kids from newborns to teens, families can trust Denver Health's pediatric team to deliver comprehensive, compassionate care when it matters most. To schedule a pediatric appointment, call 720-928-2127. That's 720-928-2127. Hey, it's Bree. I want to tell you about Heyday, CityCast Denver's first big event coming this March. Heyday is like a state fair, but it's in the city and it's indoors, and it's designed to celebrate everything we love about Denver. There's so much I'm excited about with Heyday. In particular, though, I'm super stoked to get a fortune from Zoltar, and they're going to have a claw machine where you win every single time. But there's so much more. Incredible food and drinks, live performances from local artists, and you get to hang out with me and the rest of the CityCast Denver crew. So come on down. Get your Heyday tickets now at heydaydenver.com. That's heydaydenver.com. As you said, Colorado voters decriminalized psychedelics a few years ago, and we've seen this sort of new culture springing up around it. Now that we're going to have this new regulated market, like you said, there's some things running parallel here. How does that look to the consumer?
I mean, I think our discussion so far has highlighted that it's kind of confusing because even though the regulated market has yet to get off the ground, you're seeing psychedelics kind of everywhere in Colorado right now. And there are businesses advertising in magazines that sell shrooms. And there are places that offer quote unquote harm reduction services where you can go in and leave with shrooms. And those people are not part of the regulated market at all.
Oh.
But the consumer experience, it looks like a legit business, if that makes sense. So decriminalization is really focused on like gifting and sharing. So you can go to a microdosing class, for instance. You can learn about microdosing. You can walk away with a month's worth of microdoses, right? But that is not part of the regulated system. That is part of decriminalization. And there's really been, since that has popped up, like a coming above ground for a lot of people, whether they're involved or they're just curious. So it's not hard to find, but like if you're looking on Facebook Marketplace or Instagram for shrooms and you're buying them, like that's still illegal. And anyone selling shrooms can be punished like criminally. So, it depends on what your intention is. If your intention is to find a community and get information about psychedelics in a non-formal setting, then maybe you look for local psychedelic groups or go to a local mushroom festival and connect with those people. But if you're really looking for like a novel treatment to help you with mental distress that you're experiencing, you might want to look towards the therapeutic model, which is still about to get up and running.
I see these events on calendars all the time in Denver, like come to this informational session, party festival, like you said, but you pay for that. And then it'll say like free plant,
yes.
like free mushroom emoji. So,
yes.
But if you're looking for something more, maybe along the lines, like you're saying, of treatment for depression, this is where these assisted therapy centers might be the better option.
Yes, absolutely. But I want to clarify because a lot of people are seeing in the media, mushrooms help depression. And so people are going and getting mushrooms saying, I'm depressed, and doing them at home trying to treat their depression. And I think that is becoming a real area of concern, like the self-medication of psychedelics.
Sure.
The United Airlines pilot who almost took down the plane said that he had been tripping a couple days before. And so I think it's a really nuanced discussion, like about how mushrooms can help your mental health and where you seek out the right place to do that.
And so just to clarify, even though they've been decriminalized, you just cannot outright buy mushrooms.
You shouldn't.
Okay.
When I spoke to some lawyers about decriminalization, it's very clear that selling mushrooms is illegal. It's unclear if buying mushrooms is illegal. One lawyer told me the law is not intended to punish the consumer who's just trying to obtain medicine. Another lawyer told me, well, buying would be engaging in a criminal activity. So yes. So
exercise caution around this.
Exercise
regardless.
caution. Yeah. I would just not go to Facebook Marketplace. I would not, try to order off Instagram.
I wouldn't buy substances off Facebook Marketplace, period, but...
Well, there are a lot of companies now selling them online, and I know because I tried. I was like, there's no way this works. Like, influencer has a code on her TikTok, 10% off your order. And I was just like, there's no way this works. And then it worked. My credit card got charged and substances arrived at my doorstep. And so that is, I don't know that that's legal. I probably shouldn't be admitting to that, but it was for work. It was research.
So gifting seems to be the model then at
Yes.
this point. Gifting shrooms. Okay.
Gifting, sharing, those two terms are kind of interchangeable.
So because, there's these sort of two competing things happening at the same time, there's a lot of gray area here. Do you think that there's a real chance that these therapy centers could just flop? Does it get too expensive and then people just end up buying them from their shroom guy? Like, what are folks telling you, I guess, maybe in this industry who are wanting to get into the licensed model of it?
From what I'm hearing, it is expensive to get licensed in the regulated framework. And there's nothing that prohibits some of this stuff from happening underground still. So, we'll see if these two models work in conflict or concert. But the folks who want to get licensed that I'm talking to really feel like it's a different consumer and a different audience they're trying to reach. And just to be clear, you can't walk into a healing center, buy shrooms, and leave, right? Your cost covers shrooms that you are provided for therapy, and you cannot take the rest home with you. But yeah, I definitely think that there are going to be some headwinds trying to figure out how these two avenues exist together. Because again, I think that there are places that will still offer something that looks like psychedelic assisted therapy, but without a license. And so that takes out a huge expense from doing business.
So I'm also just wondering where we're going to see an uptick in demand for shrooms, I'm assuming. And I'm wondering where they're coming from. Like, are we going to have industrial shroom grows the way that we do with cannabis?
So part of the regulated model, the psychedelic assisted therapy centers, the healing centers, can only use regulated shrooms. So these are manufacturers or growers who will get a license, grow mushrooms for only use in the healing centers, right? And the law also permits home grow. So that's why you see lots of shrooms available everywhere already. But yes, so there will be, I don't know about industrial, maybe. I don't know how big that market's going to look like. But in addition to growing and cultivating shrooms legally with a license, there are going to be manufacturers who are intending to make gummies, chocolates, tea bags, capsules, also for use within the healing centers.
Let's zoom in on Denver a little bit because Denver City Council is going to be discussing some possible new local regulations this month. Can you explain what that's about?
So the state put up its framework for healing centers, psychedelic assisted therapy, but it also left some control to the municipalities. Not enough, some would argue, because the law states that cities and counties cannot ban these type of businesses outright. That was a response to what happened in Oregon and the backlash there. But cities can regulate time, place, and manner. So where these centers operate, how they operate, when they operate. And Denver City Council is considering a proposal that mostly aligns with the state regulations. So healing centers and other businesses need to be at least 1,000 feet away from schools and childcare facilities. The only sort of additional regulation they're proposing right now is a $100 local licensing fee for facilitators without a clinical background. So we're getting into the nuance again here, where facilitation is like the supervision, and you do not need a clinical license. You don't need to be a doctor, a social worker, a nurse, anything like that to be a facilitator. If you are, then great. Denver doesn't think that you need an extra license, but if you're just getting in to be a facilitator with no other sort of medical background, they're going to ask you to pay an extra $100.
Okay. And I think this just highlights this thing that we're going to continue to see, which is the state has one set of regulations and then municipalities may be able to determine different things based on what they want to see in their city.
Yeah, absolutely. And Colorado Springs has been getting a lot of press too because the state says 1,000 feet barrier between healing centers and schools and childcare facilities. Colorado Springs City Council decided they wanted that to be a mile.
Whoa.
So like 5 times as far. So a lot of people think that they're effectively banning healing centers because they're going to have to be like way out on the fringes. And a lot of the small municipalities haven't set up regulations. Some have. Yeah, so that'll be interesting to watch it shake out.
Well, this conversation was really enlightening. At least it's I think it'll help folks understand a little bit of where we're at and how much more we have to go. It's cool. It's just we're in an early stage of this. It's really interesting.
Yeah, I hope so. And the early stage, there's a lot of enthusiasm. Oregon's been doing this for a hot minute now, and they've seen a lot of healing centers close. So I think that there are going to be kinks to work out as the system comes online. I know that there are a lot of people that are hopeful for this and hopeful that it can reach a lot of people who are suffering. So yeah, I'm just anxious to see how it all unfolds.
Well, Teeny Ricciardi, thank you so much for joining me.
I really appreciate it. Thanks for the discussion.
That's all for today here on CityCast Denver. If you enjoyed this show, why not take a minute to tell your trip sitter about us? Rate the show wherever you get your podcasts and subscribe to our morning newsletter and learn more about us at denver.citycast.fm. And if you love the show, come see us in person at Heyday, an indoor fair with Urban Flair on Saturday, March 8th. Get your tickets now at heydaydenver.com. We'll be back tomorrow morning with more news from around the city. See ya! So you're saying there's not like a blacklight poster with like a mushroom on it?
No, there were not.
It's not someone's dorm.
Correct.